Was honored to discuss these 4 abstracts at ASCO 2025. The first one was the 9-year overall survival and progressive-free survival outcomes of CheckMate 214, which really formed our basis for using Ipilimumab and Nivolumab in the frontline setting for metastatic kidney cancer. Of note, that 9-year overall survival, these are patients with metastatic disease living more than 9 years out from their initial diagnosis and treatment for metastatic disease. And so that's a really exciting thing. And I do think the immunotherapies have pushed those boundaries for an extended patients living with metastatic kidney cancer. The next 2 abstracts that I was honored to discuss were 2 that were relating to HIF inhibitors. And we have a number of patients with von Hippel-Lindau syndrome who develop tumors that are from vascular malformations all over their bodies. And so the long-term outcomes of LITESPARK-004 was in that patient population. And we saw about 70% of patients have responses in their clear cell kidney tumors. Another 50% have responses in hemangioblastomas and also in pancreatic neuroendocrine tumors. And so that's a really key population that formed the improvement of using Belzutifan in that setting. The other HIF inhibitor that's new to the landscape of clinical development is Casdatifan. And this we saw the monotherapy a couple of months ago. 100 milligrams daily was a good dose. And we saw about 33% of patients have objective responses in unselected patient populations with clear cell kidney cancer. When you add, and the data that we saw this time at ASCO 2025 was when we added Cabozantinib to Casdatifan. And of note, those objective responses improved to almost 46% across those patient populations. And so that really sets up the Phase III registrational trial called PEAK-1, which is a randomized trial of Casdatifan with Cabozantinib versus Cabozantinib in the refractory setting. And then finally, we had an abstract from the TRAVERSE trial. It's a Phase I trial of patients treated with a CD70 targeted CAR-T therapy. And these represent the first wave of CAR-T cells and cellular therapy for kidney cancer. But we saw some good responses of the patients who had high CD70 expression. There were a good population of patients who had some deep, durable responses. I know, these are very treatment refractory patients, and so we are hoping to see that improvement if these pan out. I think the key will be threading the needle between toxicities and the potential benefit. But shooting for those deep, durable responses is the key.